Good morning. I just thought I would come on and make a quick video. I'm just getting ready for work right now, but I had a comment on my last video where I talked about my endometriosis surgery, and someone asked me, they said something like, I'm having surgery soon, I'm pretty nervous, I've never had general anesthesia or surgery before. What does it feel like to have general anesthesia, and what does that whole process look like? Excuse me. So I thought I would make a video to just kind of quickly talk about what is the actual process and what actually happens when you're going in for surgery, more so than talking about the actual experience I had post-surgery and everything like that. So usually you have your appointment for surgery booked. Well, actually first you might have a pre-surgical clinic, so either a nurse will call you on the phone to ask you some questions. If you have any other pre-existing medical conditions, then they might ask you to come in a few days earlier to an actual pre-surgical clinic at a hospital where you'll be seen by a nurse, an anesthesiologist, and anyone else that they may want you to see. And they'll just ask you some health history questions and maybe go through some of your history. Maybe they might want to do an ECG or blood work or things like that, just depending on what you have going on. And then you'll get your time that you need to show up to the hospital for surgery, and you will go in to register to check in, and they'll call you back and they'll give you usually a gown to change into, some little disposable little booties for your feet. Depending on the hospital and what surgery you're having, they may give you compression stockings to wear on your legs. The hospital I went to, they just gave you kind of knee-high socks to wear that were just, I think, for comfort, to keep you warm. You may get a robe over top and a hair cover. So once you're all changed, there'll be a nurse that will be the person that will kind of take care of you until you go into surgery. And she'll, again, maybe might ask you some more questions. She's going to start an IV in your hand, and not usually in your hand, hopefully, but in your arm. And then IV, they usually put a tight rubber band called a tourniquet around your arm to keep the blood into the vein. And that can sometimes be tight and uncomfortable because depending on your veins, they may have to make it really tight to get the blood to stay in the vein so the vein plumps up so they can see to put the needle in for the IV. And it's not that bad, it's like it's a poke. I feel like the tight tourniquet actually hurts more than the actual poke sometimes. But you'll have the IV in, and once it's in, it's fine, and they may give you some fluids, they maybe give you some antibiotics, and usually at this point you're sitting kind of in a little curtained off area, either in a hospital bed stretcher, or I was sitting in a recliner chair in the hospital that I went to. And they'll give you warm blankets to keep you warm and comfortable. They may give you an injection, a sub-Q injection, so just in the little kind of fat of your arm or your belly, just a little needle. They may give you an anticoagulant like heparin, depending on if your surgery is going to be a really lengthy one and they don't want you to develop any clots because you won't be moving around and you can be at higher risk for developing clots. So they may give you a little injection of that. If you do get that, just a heads up, it really, really stings. The needle actually going in doesn't hurt, but the heparin really burns really, really badly. But it's important to get if they tell you that you need it. And once it's done, it's done. What else? Yeah, that nurse is going to ask you a whole bunch of questions. Anesthesiologist is going to come and assess you and ask you questions. And by assess you, I mean they're just going to see, can you open your mouth really wide? Do you have good movement of your head and neck? Because they want to make sure that you're going to be easy to intubate when you're under general anesthesia. So that means put a breathing tube in. And then you just kind of wait. If you feel like you are anxious or you're the type of person that's going to be really nervous or anxious, you can ask for them to give you something at this point. I asked and had an Ativan while I was waiting, and my surgeon was actually a little bit behind, so I had to wait a little longer. So it was actually perfect because after they were done talking to me, I had an Ativan and I kind of just slept with my husband sitting there until it was time to go in, and it really helped calm me down. I didn't really feel nervous at all going in. So once it's time to go in, they'll ask you to go to the washroom and drain your bladder, and then the nurse will escort you into the operating room, and they will want you to take your robe off, and they'll have your gown undone at the back because you're going to be laying on the operating table kind of with your skin against the table. You're not going to be all wrapped up in a gown. They'll usually pull your gown down a little bit to here to put a couple stickers on for heart monitoring. They'll get you on the table, get you all nice and comfy. The anesthesiologist will usually put a mask over you for pre-oxygenating you. They'll just ask you to breathe deeply, and then when it's time, they're going to give you the anesthetic. And depending on what they give you, typically it's usually propofol where I live, and it's known that that can actually burn and sting really bad. But it doesn't always. And when I had it, it didn't burn at all, actually. It just depends on, I think, the anesthesiologist, your vein, how quickly they push it. And depending on how quickly they push it also will determine how quickly you fall asleep. So the person asked me, do you just kind of conk out? Do you kind of slowly drift off? So it depends. If they push it more quickly, you'll feel like you're awake to out, like that. If they do a little bit more slowly, it just takes a few seconds, but you'll feel like your eyes are getting a little bit heavier, and then you just will be asleep. So that's what that part feels like. And then all of a sudden you wake up and it's done, it's over. Usually when you're in surgery, they will put in a Foley catheter in to keep your bladder draining while they're doing the surgery. What else? So sometimes, depending on the length of the surgery and how you respond to anesthetic, you may wake up on the operating table, not during the surgery, but I mean after they're done and they're going to wake you up. You may wake up when they're and have some memory of them moving you from the table to a stretcher and taking you up to the recovery room. Or you may not recollect any of that, and you may wake up in the recovery room, or be aware, I should say. Of course you're going to be awake, but you'll be aware when you're in the recovery room before they're ready to let you go back out into the day surgery area. And you feel just really tired. You might have some nausea, you might have some pain. They should ask you if you have any of those things. Hopefully you won't have nausea. Usually for abdominal pelvic surgeries, they'll give you lots of anti-nausea medication during the surgery through your IV. But if you are nauseated, let them know. If you have pain, let them know, because they'll give you something for pain. They'll really kind of load you up before you go home, and it really can help with the pain for the next little while. They'll want you to get up once you're back out to the day surgery area, so out of the recovery room. They'll want you to typically maybe have something to drink, maybe have a little piece of toast or cracker, depending on where you go. What hospital I mean, and they'll also want to make sure you can void or urinate, so they'll ask you to get up to the bathroom. And then usually once you can do all those things and your pain's okay and you're not nauseated and you can walk a little bit, then they'll usually let you go. So that's generally what happens during surgery, and that is just where I have experienced it, where I live and also where I work as a nurse, seeing this. It may be different in your country or your city. It may be different. So this is just kind of what I know to happen. So anyway, I hope that helps. Try not to be too nervous, too afraid if you're going for surgery. You'll be okay. It's not the easiest thing, but it's not the hardest thing in the world either. And once it's over, and it's such a small section of your life experience that when it's over and you look back on it, it really won't seem like that big of a deal. Okay, so I hope that helps, and I hope you guys have a great day. Bye.